Hi parents, this is Dr. Leslie Blevins with Enilda Clinic at enildaclinic.com. Today we're going to talk about your worst fear. That's right. I want you to pretend that you just got finished at the school, just had the parent conference, or you just came back from the preschool picking up your little buddy and someone just said to you, I think that your kid needs therapy. That's a gut kick right there. I have been there and I have had these conversations with parents where they get the news that something's wrong with little Timmy. And by wrong, I mean that little Timmy's struggling. And whoever this concerned, person is who has this conversation with the parents, on their side of things, it's always a really hard conversation because for a parent, their child is an extension of themselves. It's their heart outside their body, right? And to hear that there's something not quite right, for most parents, I would say that is really hard to hear. And so, what might be your very first thought if you put yourself in this hypothetical situation where somebody's now said that to you, but you believe that person, right? Like, this isn't just some Susie down the street and you don't really believe that she knows what she's talking about. This is somebody that you truly do believe and buy into their perspective, and they've said this. What do you immediately think? What's your reaction? Well, I can tell you from my experience that the parent's first thought is, did I do this? Whoa, that is a hard thought. And I did just go there. I did, because I think that this thought is actually the little teeny tiny seed that is deep down inside, that is a seed of fear that actually controls most of the decisions that a parent makes early on whenever they have a creeping little thought in the back of their head that, little Timmy might need some extra support or some early intervention, or just, some early interventions with behavior, maybe speech or something else. But there's this creeping little thought that might mean that I did this. That might mean that I didn't do something right. That might mean that I didn't notice soon enough. That might mean 1,000,001 things about me as a parent. And that is a really hard thought to face. So, what do I want to say to this super, super scary thought that I, as a psychologist, encounter every week with families as we are, starting the process with their children, whenever we're first discovering what's really going on under the hood with their kids? I can tell you that I've never met a parent who wasn't doing the very best job they knew how to do. And yeah, every parent has a different skill set, but I've never met a parent who was intentionally not giving their kid absolutely everything. In fact, I meet parents who are giving their kids so much that they're actually not, emotionally and spiritually feeding themselves. And that actually turns into a difficulty for the family and even for the child, because the parent's resiliency starts to suffer. So I've seen the opposite, where a parent's not taking care of themselves, but for a parent to intentionally withhold support from their child, never seen that. I have seen parents who have not known the research in different areas, like developmental delays or reading disorders or ADHD or 1,001 other different areas, and therefore they didn't know what decision to make. And I've seen them not know the signs until their child was a few years older than, what would be ideal or what the research might say we want to intervene. And that's okay. I don't know, astrophysics or how to predict the weather or other things. And that's fine. Sometimes I get caught in the rain, but that doesn't make me a bad person, right? To get caught in the rain. And I think maybe sometimes as parents, they are thinking that they need to predict and control everything in their child's environment, and even maybe biologically, like what their child was born with, the biological history that you as the parent received that you had no control over, and all those contributions that led to your child's current presentation. That's a lot of responsibility. And so, in summary, what I want to say is, hopefully at this point, what you're getting a sense of is that it's really overwhelming to accept full, total, complete responsibility for your child's presentation. I think it might be impossible. I have yet to meet a parent who I could assign 100% responsibility. Now, what I will say is, as a behaviorist, and a behaviorist is someone who believes that essentially we learn based on the consequences in our environment, I will say that I believe that parents have the ability and the responsibility to learn as much as they can so that they're continually doing the best that they can, right? We do the best we can until we know better, and then we do better. Oprah said that, and she is right. And so I believe in that, and I believe that with that in mind, that philosophy of continuing to learn and doing better, that we can, all of us in the field of mental health and behavioral health, can help parents and support parents to have scientific based, research based interventions and supports that help them to make the very best decisions for their children, and supporting teachers and principals and other school professionals so that they can support parents to make the very best decisions for their children, so that good decisions aren't delayed, right? Because I've never met a teacher who has made a bad choice intentionally for a child. Never. Every single educator I've ever met has done the very best that they could do with what they've been given. And so what I think there is a gap in understanding as far as the research and the knowledge base and what we have to do every day just to survive, and helping everybody to come together and to have the information they need so they can make the best choices that they can. I think accepting responsibility for the biological components of it too is just kind of accepting responsibility for what may come in the world. Again, it's accepting responsibility for the weather whenever that's constantly changing. So I hope that maybe this perspective might be helpful for you to take a growth perspective, to help you to maybe hold in your heart a sense that change is a part of the world. It's a part of your child's life. It's a part of your role as a parent, and embracing new information about your child might actually help you to feel more effective, and it might help your child to feel more effective and to feel happier. And I think it's scary whenever we don't know how to be more effective. That's often the moment in time just before a parent knows what's going on with their child. They feel like there's no way for them to be effective. And then right after they figure out what's going on with their child, they get this glimmer of, okay, there are pathways out there to be effective. And so there's often this very pivotal moment of change where I feel like the parent can let go of that responsibility that the world is just how it is, and things have developed how they have, and they couldn't control the billion things that happened to create the situation that is presently here. And they can choose to move forward and to start influencing their child and the environment their child is in to give them the best outcomes possible. All right, guys. I will be posting more videos on here, and if you'd like to sign up for the listserv, you can do so at enildaclinic.com. All right, see you next time. Bye.